Hello, hello, hello. Happy New Year. Let's see. We have a video, What Americans Don't Understand About Public Health Care by Kraut, K-R-A-U-T. And as always, the description and everything, the links will be in the description. Let's make it big. Alright, so I'm gonna see what Americans don't understand, what he thinks, and then I'm gonna go give my reaction. Jimmy Carter, I don't know who that is. Barack.
Public healthcare has been a constant re-emerging topic of contention within United States politics as far back as I can remember. It is a topic of contention in the current election cycle and will in all likelihood be in future elections again. Watching this debate as a European living with such a healthcare system...
We didn't really talk about healthcare that much this election cycle with Hillary. Dang it, Kamala and Trump. I don't really remember either of them talking about healthcare. So it was a hot topic in 2016 and 2020. But that was mostly because of this man, Bernie Sanders here, who's on our side, but not many other people are. So I backed up a little bit so we could hear what he's saying.
Contention in the current election cycle and will in all likelihood be in future elections again. Watching this American debate as a European living with such a healthcare system, there is however something that has always been strange to me, which is that not one proponent of such seems to have an idea of what it is, how it would work, how such a system would be built, and what it would require from everyday citizens as well as society at large.
From what I hear, we pay taxes. Right now we pay in our health insurance, right? So we pay $600 to some pay $1,500 to $2,000 depending on how big your family is and whatnot. So if I'm paying say $600 or $700 a month in insurance, if I was going to pay that in taxes or less, then I'd be cool with that. You do tax the rich probably a little bit more than what they're paying in their health insurance, but I'm okay with that.
Most American proponents of public healthcare seem to get their idea of what it is and how it works from a Michael Moore movie, a movie that does an absolutely awful job at presenting the systems we have in European countries. All it really does is show us English and French doctors and nurses proclaim how superior these countries' healthcare systems are, and that's pretty much it. But there's far more to it than that. Those two countries have vastly different systems and are more on the extreme ends of what public healthcare is. Especially giving England as an example of a great public healthcare system is somewhat ridiculous, because the NHS, the National Health Service in the UK, is one of the worst healthcare services in Europe. Created during the 1950s in the post-war consensus, an age of massive centralized government organizations and public spending, the NHS was plagued from the beginning with a massive entangled bureaucracy. Detangling and reorganizing the system during the 1970s barely fixed the problems. Things were made worse under the Thatcher administration through the introduction of a management system intent on cutting back costs and increasing efficiency, and substantial damage was done to the NHS by the government of Tony Blair. He believed
bureaucracy is always not good. Too much bureaucracy, you need to have records and whatnot, but not too much paperwork going on.
That the public,
but so far, the cost of our insurance is twice as much as anybody else's, and we don't get as good an outcome. So
public service could be run like a private company despite having no market competition. His government introduced a system of quotas and standards meant to artificially replicate market pressures. This was meant to make the overall service more efficient, but in the end accelerated its declining quality. Subsequent British governments have done little to resolve these issues. Not all is bad on the British Isles, though. In 1999, Scotland retained control over healthcare legislation from Westminster for the NHS Scotland. They avoided the Frankenstein reforms Tony Blair forced on England, created their own institutions, smaller bureaucracy, centered around 14 local health boards run by officials specific to manage these regional healthcare needs. Overall, Scotland's public healthcare performs better, and giving England as an example to Americans of how a public healthcare system is supposed to operate and work is just a giant misconception and misleading.
Well, some people, they just picked the wrong place, right? So instead of saying England, say Scotland. That's all.
England is an extreme example, and it is more of an example of how not to do it.
but they still have better outcomes than we do and a lower cost.
France is on the opposite extreme. The services look amazing to foreigners, like the fact that every mother gets a nurse assigned to her by the government to help her out through the first 2 to 4 years of motherhood, until her kids are old enough to go to kindergarten, which, in France, is also government funded. But
that is quite a long time. So that's like a real job then, I guess. Like somebody helps you mother your child. I wonder how long they're there. Like, are they there 8 hours a day? Or are they there like they just come once a week? Like, that... I'd like to know that.
But what Michael Moore and others who praise the French system don't show you is the enormity of costs and the size of the apparatus behind this system. France,
the enormity of cost. Again, I'm pretty sure we pay more than they do per capita.
on average, spends between 12 to 15% of its national budget on its healthcare
And we
system.
pay 20.
Every French citizen is required by law to pay into a national health insurance fund. The amount
We were, Trump took away the mandate, but we were forced to pay, get health insurance or get fined.
of the fee being determined by the individual citizen's income. France also has taxes, for example on gambling and casinos, the revenue of which specifically goes straight into the National Health Insurance
dig
Fund.
that.
The system, which is centralized and run by the Ministry
Tax the Vegas casinos, a hefty amount to pay for national health care, at least to help pay for national health care. There's casinos in Atlantic City, and I'm sure there's casinos up around now. There's casinos in Ohio now. So, yeah, use a casino tax, and like out here we use a hotel tax to. Oh no, that's Vegas. We don't use a hotel tax. I say we should use a hotel tax, but in Vegas they use a hotel tax too. Like, just tax some stuff, especially stuff that's not needed, and then especially tax like rich people stuff, tax like high-end restaurants, tax like private jets, tax stuff that I don't know about because I'm not rich enough to know.
of Social Affairs, Health and Women's Rights only works due to the massive amount of funds and resources allocated by the French state to ensure its viability. It
Yes.
works because the French are willing to pay the taxes and fees required to make it work.
It works because they're willing to pay the taxes and fees to make it work. That's what universal health care is, us paying the taxes and fees to make it work rather than having to pay the health insurance companies to deny us claims.
And this is where we go from Americans having wrong impressions about public healthcare to their understanding of it being also somewhat flawed.
Ooh.
Because the debate about a public healthcare system is about far more than silly pedantic meandering over whether or not it's communism. It's a debate over structure, taxes and social sacrifices made, as well as burdens upon the individual or society at large. Whenever I saw a Bernie Sanders or other US politician continuously talk about how much they want a public healthcare system, the only thing they ever talk about is how much they want it, how great it would be for everyone, but never about what it means for the country and
Bernie Sanders talked about taxing the rich all the time. He talked about how high drug prices are and how you wouldn't have to pay these high drug prices, and he took people to Canada on bus trips to get lower prescription drugs. He talked very in-depthly about what it would look like.
how it would be structured, built or implemented. There are simply questions, however, that must be asked, like
I think either he hasn't watched Bernie Sanders or then he's being disingenuous if he has, because Bernie Sanders has plans and had plans on his website, all that stuff. I don't know. I haven't been to his website in a long time, so I don't know if it's still there or not. But I mean, you go the Joe Rogan thing. I'm pretty sure he laid out the plan on the Joe Rogan podcast that he was on.
is the US government even willing to allocate 12% to 15% of its annual budget into such a system? How well would it bode with ordinary US citizens, however, that must be asked? Like, is the US government even willing to allocate 12% to 15% of its annual budget into such a system? How well
think we
would
paid
it bode
20%
with
already.
ordinary US citizens to levy additional taxes from them for such a system?
I heard it was 20%, but this here says it's 17.6. So the National Health Expenditure Accounts, NHEA, are the official estimates of total health care spending in the United States, dating back to 1960. The NHEA measures annual U.S. expenditures for health care, goods and services, public health activities, government administrations, the net cost of health insurance, and investment related to health care. The data are presented by type of service, sources of funding, and type of sponsor. The U.S. healthcare spending grew 7.5% in 2023, reaching $4.9 trillion or $14,570 a person. As a share of the nation's gross domestic product, health spending accounted for 17.6%. I've heard in some other things that it was 20%. This is a national government thing, so let's look at 2014, see if this says something different here. 8 billion, 4.1 billion. Okay, I don't see it as a percentage here. But again, this is cms.gov. Look up just the percentage of GDP. Let's see what I typed in. What percent of GDP does the U.S. spend on healthcare? And you'll get this. Check it out yourself. That's if you want to check it out yourself. But now back to the video.
Percent of its annual budget into such a system. How well would it bode with ordinary US citizens to levy additional taxes from them
I
for
think
such
he
a
said
system,
15%,
and how
right?
it would be structured, built or implemented? There are simply questions, however, that must be asked, like, is the US government even willing to allocate 12% to 15% of its annual budget into
So
such
12 to 15% would save us 5 to 2% on the healthcare cost. So I think, why wouldn't we want to save a little bit?
a system? How well would it bode with ordinary US citizens to levy additional taxes from them for such a system?
But we levy additional taxes from them, but tell them they don't have to pay health insurance no more. Whatever your health insurance cost is, you don't have to pay that. And also, you won't have a deductible now, or it'll be very small. Like if we have national health care, we should just get rid of the deductibles too. Just put that extra $1 or $2 in our taxes.
Because the bottom line remains that taxes paid to ensure the functioning of such systems in European countries are not just levied from super rich. No, they are paid by everyone. So in
Right. We all pay health insurance now, right? And in fact, the super rich, see, that's probably the point too, right? Because if you're not the super rich, if you're a regular person, you pay health insurance, right? And so you'd rather pay a cheaper tax to get better health care coverage. But rich people, they don't even have to pay health insurance because they make more money just investing, right? So their money just gets bigger and bigger. Why would they put into health insurance? Because they get hurt, they just go pay out of pocket. They don't care because depending on how rich you are, right? They don't need money. Or they don't need money. They don't need health insurance because they got the money. They can just pay. And a lot of times, if we don't have that thing here, or if they have a better something somewhere else in the world, they're going to go there anyway. So American health insurance wouldn't cover that anyway. So why would they? They don't want or care about insurance.
In the end, this is a tax burden that will come down on ordinary working people just as
Yes.
well. And if you do not have this conversation as you campaign for public healthcare, you will eventually be forced to having this conversation when you try to implement it through the legislature.
But Bernie had that
Beside
conversation all the
financing
time.
and taxation aspect of public healthcare, there's an additional aspect never talked about in the US political debate. If you are an American and you have ever been to Europe, you may have
be an
noticed
American?
Coke tastes different here. It's less sweet. The reason is that our governments regulate the contents of sugar and take an interest in how healthy or unhealthy the produce we consume is.
I could go for some of that. Like, I don't want our products to be terribly unhealthy, but we do have the freedom to choose, right? We're the most free country in the world. But our food products, we have a lot of poison in it. Our Fruit Loops are a brighter color, and they put food coloring in it just to make it brighter, to make it more attractive to kids than Fruit Loops in other countries. But we don't need that. They don't need to be brighter if it's not going to do anything nutritionally, right? It's not a thing, or it is a thing, but we don't need that.
Countries such as the UK even have a sugar tax. Denmark has a tax on fat.
Okay,
Most
yes.
European countries have high tobacco tax.
So yeah, tax sugar, tax fat, tax tobacco, things that make you unhealthy, right? Because if we have a national health system, the burden is now on everybody. If you smoke cigarettes and you get lung cancer, you don't have to pay any more in taxes. You still get help. The burden is now on everybody. If we have a privatized health system, you're paying your own insurance. If you're smoking, your insurance is going to go up. If you're overweight, your insurance is going to go up, right? If you're diabetic, your insurance is going to go up. Things like that. So if you don't have insurance, if you just pay taxes, then the burden is on everybody. So the government has more of an incentive to help you stay healthy, or help you be healthy, get healthy, stay healthy, whichever it is.
Sweden has a very high alcohol tax. European countries have the strictest regulations on food quality in the world. Even beyond just a simple what we eat and drink, it is also how we buy that is regulated. The UK, for example, banned the advertising of candy and sweets using cartoon characters or any other advertising method that specific.
Okay, so like, I don't really care if you put I understand it because it draws kids in, right? And so to me, it's not a big deal if you're not allowed to put cartoon characters on candy. They didn't take away the candy, right? Kids are still gonna want it, maybe a little bit less. I don't know, but who cares?
Specifically targets children. Outside of food, there are government incentives and initiatives to keep citizens healthy, from subsidized fitness and sport initiatives down to extensive fitness programs for school kids.
How fantastic does that sound? They still have gym class. We don't even have gym class in America no more. They have fitness programs for adults. Like, are these fitness programs free? Are they like classes that are ran by people? That sounds amazing. Like, just is he trying to say that it's a bad thing?
Why? Let's leave Europe for a great example. For example, banned the advertising of the produce we consume is. There's an additional aspect never talked about in the US political debate. If you are an American and you have ever been to Europe, you may have noticed that Coke tastes different here. It's less sweet. The reason is that our governments regulate the contents of sugar and take an interest in how healthy or unhealthy the produce we consume is. Some countries, such as the UK, even have a sugar tax. Denmark has a tax on fat. Most European countries have high tobacco tax. Sweden has a very high alcohol tax. European countries have the strictest regulations on food quality in the world. Even beyond just a simple what we eat and drink, it is also how we buy that is regulated. The UK, for example, banned the advertising of candy and sweets using cartoon characters or any other advertising method that specifically targets children. Outside of food, there are government incentives and initiatives to keep citizens healthy, from subsidized fitness and sport initiatives down to extensive fitness programs for school kids.
Make America healthy again.
That
seems weird that he talked about all that and then he made it sound like it was bad. I thought all that was pretty good. I mean, nobody wants to pay taxes, but I mean, if you have a universal healthcare system, you want people to be healthier, so you tax stuff to make people drink less alcohol, eat less sugar, and just live healthier.
Example for why. Japan has a public healthcare system. It is one of the best healthcare systems in the world in terms of quality and efficiency. Japan is also the country with one of the world's best healthcare systems that spends the least money on it.
Sounds
because
good.
Japan also has the healthiest population in the world. Once you have a healthcare system that is financed by taxpayers, the taxpayers, and by that extent the government, have a vested interest in the health and well-being of the taxpayers. Or rephrased, if you are morbidly obese in the United States, it is your responsibility, or should I rather say, your lack of responsibility. It will reflect itself within the costs you pay to whatever insurance company you sign up with. You pay the consequences, not just in diabetes and cardiac arrest.
And so this is kind of what I was saying earlier, like if you smoke and you're walking around in public smoking, or if you're big and overweight eating McDonald's walking around in public, and in our system, no one cares, right? It's all competitive. We don't care about you. You got your own insurance or you don't have your insurance, whatever, who cares? But if you're in Japan, you all know that you pay into the same system, and if you walk around smoking, they're going to be like, oh, this dude's like a drag on our healthcare. If you walk around obese, they're like, oh, this person's a drag on our healthcare, that, you know, you're just going to be in the hospital more, you're going to be using the services more.
Rest, but financially. In a country with a public healthcare system, if you are morbidly obese, taxpayers. Or rephrased, if you are morbidly obese in the United States, it is your responsibility, or should I rather say, your lack of responsibility. It will reflect itself within the costs you pay to whatever insurance company you sign up with.
Right.
You pay the consequences, not just in diabetes and cardiac arrests, but financially. In a country with a public healthcare system, if you are morbidly obese, costs for your resulting treatments are paid by other people's taxes. It is consequently no longer just your responsibility. If you are fat in a country with a public healthcare system, you are a burden on society. And there's a question to be asked.
So it switches from personal responsibility to kind of like a public responsibility.
And answered of whether the people of the United States can even put up with such a standard. Personal.
So I'm assuming, yeah, he said he was from Europe. And so he's calling us out. We couldn't put up with such a standard that we got to hold ourselves accountable to our fellow Americans, is what I just heard.
on society. And there's a question to be asked and answered of whether the people of the United States can even put up with such a standard. Personal responsibility and independence is at the core of the country's identity. Seeing your actions and your life within the wider framework of how they impact society at large is not necessarily something attractive to many Americans.
Right, personal independence or personal, not property, personal, dang, what did I just say? What did he say?
Of the country's identity, seeing your actions and your life within the wider and there's a question to be asked and answered of whether the people of the United States can even put up with such a standard. Personal responsibility and independence is at the core of the country's identity.
Versus a communal responsibility. Like if you know that it's a communal thing, this healthcare stuff, then you know walking around obese or walking around smoking, other people are going to look at you. And you have a responsibility then, but Americans aren't ready for that. They don't want that. They only have personal responsibility.
Seeing your actions and your life within the wider framework of how they impact society at large is not necessarily something attractive to many Americans. Additional taxation on unhealthy produce, as well as a government-sponsored and encouraged incentive to live healthy lives, is also something that most Americans would probably
I want you to bench press too.
Not even accept. A few years ago, the former mayor of New York, Bloomberg, attempted to ban the biggest sized soda bottles in measures intended to incentivize healthy living for New Yorkers. New York being a place that will probably be...
Well, if he's trying to ban those size soda bottles, those aren't supposed to be single-use bottles.
pro-public healthcare, protested that measure substantially to the point that it was rejected. However, in a conversation over whether or not to have a public healthcare system, such measures are part of the conversation that are simply unavoidable. Yet the proponents of public healthcare in the United States don't ever discuss this.
Yes, they do. Right now, we got RFK with the whole Make America Healthy Again. And RFK he wasn't born yesterday. He's been around. He's been talking. I don't know if this guy's heard of him or if you guys listen to him or not, but I've heard of RFK and I've seen him talking about vaccines and all kinds of different healthcare stuff. Bernie Sanders has plans and talks about it. Elizabeth Warren has talked about it. I seen, what's her name, Nancy Pelosi, like in the 80s or 90s talking about universal health care. People talk about this.
American politicians who argue for public healthcare only ever say that they advocate for it, but never actually lay out any policy plan for how to finance such a system or even what's...
Many do. That's a lie. That's just not true.
American politicians who argue for public healthcare only ever say that they advocate for it, but never actually lay out any policy plan for how they would finance such a system or even what such a system would look like. But also more crucially, how they would incentivize Americans into being healthier. And that is an important conversation that must be had, especially when you keep in mind how unhealthy the average American is. A public healthcare system is not intended to be a daycare for obese people to continuously even out the consequences.
We've been talking about education a lot, and he even said that in the schools they have a better, they did something healthy. I said gym class, right? So a better education system that people understand and know what adverse effects are of smoking, overeating, whatever, all that's anything bad, crossing the street at the wrong time, right? You got to understand things, but I'm a personal trainer. I've worked at a few different gyms, and I've noticed lately that the young people are working out. They are buff. Like, people are just walking around all diesel. I don't know if it's just Hawaii. I hope it's the entire world. But, like, people are starting to understand, right? There was a couple generations where people were probably overeating a bit and getting a bit chubby, and that's not fun, right? And so, like Kevin Samuels always says, look 100 years ago, 150 years ago in your family, to your grandparents, your great-grandparents. None of them were real big. Like, we're starting to get a little bit past that now, but like say in the 20s, right, the 1920s, there was not very many fat people, if any, because they ate well. Now we got all this McDonald's and all this other stuff, right? Just so, but education is the incentive to help people not be overweight. You have kids right now, you have them still have gym class, you work them out, make it part of the routine, and then just try to talk to adults, but you can't make adults really do nothing. You can maybe incentivize it by paying a little bit less taxes or something
of their irresponsibility. And if you introduce a public option without incentivizing a healthy public, that is exactly what your healthcare system will turn into. I personally don't believe a federal centralized public healthcare system like in France would work in the United States. The country is too big, the bureaucracy would be too large, the taxpayers unwilling to pay, and the political landscape unwilling to put up with such. In France, there's a consensus amongst
the biggest thing is we just need to get rid of the bureaucracy. Like, Obviously, there's going to be a little bit. You got to bookkeep, but we just do too much of that. Too much middleman stuff. It's too much needless job things.
Unwilling to put up with such. In France, there's a consensus amongst both sides of the political aisle to ensure the healthy state of their healthcare system. That
even the far right in France wouldn't touch their healthcare system.
Bipartisan consensus does not exist in the United States. If a Democratic president were to introduce it, it would only exist until...
See, that's because we have two right-wing parties, and a right-winger normally doesn't want stuff like that, right? But since they already have it, since their left-wing party won, the right wing can't fight something that's that popular. Since we have two right-wing parties, there's no left wing to pull us into the healthcare. If we had the Green Party, or if the Democratic Party was actually left and actually cared, and we actually got the people to understand, and we, even if they didn't totally understand, if we passed universal health care, imagine if we had universal health care during COVID. Bernie Sanders won in 2016, passed universal health care. We got that, not knowing COVID was going to come, but he would have done it anyway, right? That's his thing. We'd have had universal health care, COVID would have came, we'd have handled it better. We'd have all been not as scared, we'd be able to go to the hospital when we needed it, stuff like that, and stuff would have been more paid for. But we ain't ready, he says.
Does not exist in the United States. If a Democratic president were to introduce...
So the consensus doesn't exist in the United States, but our consensus is a right-wing consensus. We have two right-wing parties. So they have the consensus that people don't need universal health care. We need a left-wing party to push the consensus of the people. Once we get universal health care, our right-wing party will come to the consensus that we need it, because the people will just not vote for you if you say you're going to try to get rid of health care.
Introduce it, it would only exist until the next Republican president comes into office. Additionally, I don't believe a centralized...
Exactly, but he wouldn't come into office. If he's going to run talking about, I'm going to get rid of health care, nobody would vote for him if we had universal health care.
Until the next Republican president comes into office. Additionally, I don't believe a centralized federal healthcare system is even desirable. The system I prefer the most is one you got a taste of in the beginning of this video.
Well,
countries such as Germany and Austria employ a system in which healthcare is federally mandated and even subsidized, but implementation of the system is largely handed over to the individual states. I don't believe that a top-to-bottom federal healthcare mandate would work in the United States.
Federally mandated and handed over to the individual states. That is probably the bureaucracy stuff, right? You have a little bit less bureaucracy or easier bureaucracy if you break it down a lot. The only thing with that in the United States is that we have a lot of poor states, like Louisiana, Alabama, Mississippi. These states are going to have way different type of funding than a place like Hawaii, California, Florida, probably like Ohio, Michigan, probably are pretty well-funded states. So in the U.S., in our 50 states, New York, California, Florida, pay for a lot of our poor states. Like a lot of our poor states don't even put into the federal stuff. Our federal stuff puts into them because they're so poor. So if it was just federally mandated and put down to the states, then it would need to be highly subsidized for a lot of these states.
United States. And what I would propose to Americans who wish to have such a system is to abandon the idea of a federal public healthcare program. The legalization of cannabis shows how reforms are best implemented within the United States, namely through legislation in the individual states to then convince those in other states of the viability of the reforms. I
gotta say, I don't agree with that. That is so slow. Marijuana should have been legal 20 years ago, and it should have taken a day. Marijuana should have never been illegal, right? But it should have been legal probably in the 80s or 90s, maybe the early 2000s at the latest. But I mean, it's such a slow process to do it that way. Incremental change, slow incremental change, that's, people die with that, right? Especially with healthcare. People are dying not getting their healthcare.
believe it would be better for the American advocates of public healthcare to campaign for public healthcare in their home states through state legislature and the governor's office. Not only are such efforts more likely to bring results, but would also achieve a public healthcare system without the consequent possibility of having the federal government step in and dismantle it if the...
I agree with what he's saying here. Like, if the federal government's not going to do it, then go ahead and do it yourself, right? Like, if you can't get it done at the biggest level, get it done at any level. Show that it works. Have somebody else do it at that level. Try to grow, and then you get it at the federal level.
those in power of it oppose it, as the centralized British government would have done to Scotland if they hadn't retained control of their healthcare service in 1999. Such a regional system is also more efficient and more in touch with the people within the comparably smaller state it has to serve, and the advocates of a public healthcare system would also be more in touch with their own communities, and therefore it would be easier to debate and implement subsequent other measures incentivizing healthier living and finding the revenue source for the system.
All that is true, but again, some of our states don't have any revenue. So, okay, that's the end of that. But yeah, so again, Alabama, Mississippi, probably like Oklahoma even, a lot of our states don't make money and don't have the revenue. And our richer states, like California has the GDP of like the 5th largest nation in the world or something like that. At least the top 10 nation, I think. So they pay for a lot of the rest of our country's stuff just because of how much they make, just geographic wise and whatever. Everybody wants to be there. So I get the local style, do it by state. Yeah, start where you can. Call your mayor, run for any office. Go call the Green Party, get on the Green Party. I did. I'm about to fill out the application to run for the Green Party. So you do it too. Everybody, call the Green Party, run. If you want to infiltrate the Democratic Party, please don't. But do something, do that if you feel you must. But join the DSA, anybody. And then, yeah, either join something and let's make it happen. Start at the state level, go to the federal level, whatever. Call your peoples. You know, the way we got to change things, we got to do everything from across the spectrum.